200 new cases reported today, 499 of those in the upstate. 23 new deaths, with one being local. And that brings us to 1,550 patients hospitalized as of tonight, and 203 of those are on ventilators. The total cases in South Carolina, 60,220, and if we have another day with 20-plus deaths, we will surpass the 1,000 mark on Wednesday. Tonight, the recovery rate is at 92%, one of the highest we have seen in some time. Well, as COVID cases continue to spike, contact tracing, as you can imagine, getting harder and harder to actually do. In the beginning, DHEC said they were all over this, making phone calls to all positive patients in just a couple of days. But now, with so many cases, they're beginning to drown, saying they are in the middle of trying to hire and train new case investigators daily. They want to get their response times back down, but as it stands right now, it's taking weeks for them to get in contact with positive patients. Fox Carolina's Kayla Conboy live tonight for us. Kayla, what else did DHEC tell you about this contact tracing issue?
Well, they say it's really important to try to keep up with this contact tracing, saying oftentimes it's a way to help warn people or to find those people who may not be showing symptoms yet. We've heard the phone calls positive patients get after getting their test results back. They usually take about 30 minutes with contact tracers asking specific questions about where you've been and who you've been around. But those callers are bogged down, and the state is working to change that.
There are 225 of those individuals who are in use out of a total of 600 who are trained. And so we are bringing those, basically moving those 600 trained individuals over to the in-use category to be able to meet the increasing demand.
In addition to that, DHEC says they have access to 1,000 new tracers they can pull in if needed.
There's at least 3 and I believe 4 companies from whom we can continue to get people. And so I think that's where that 1,000 number has come from in the past, is that yes, we set a goal of reaching 1,000. We got a bunch of volunteers.
As well as new hires. They've hired 10 new people this week alone, saying contact tracing is important to keep up with, even if it seems impossible with the caseloads.
Sometimes in a pandemic such as we're in now, when the number of cases really increases rapidly, we outpace our capacity to effectively do contact tracing.
But instead of giving up, they're ramping up. They say it's important for the public to understand the difference between case investigators and case monitors.
Case investigations. So we have, and those are typically more highly trained individuals that can question the person who tested positive, and then do contact tracing, which is that activity of determining who your contacts are.
DHEC also says it's really important to keep your phone on as much as possible and to answer phone calls even if you're not sure about that number, don't recognize that number. They say they are really just trying to reach people on the first call. Reporting live, Kayla Conboy, Fox Carolina, the 10 o'clock news.